The Bedside Mobility Assessment Tool, or BMAT, empowers nurses to assess patient mobility and identify the need for appropriate safe patient handling and mobility equipment. Each mobility level has recommended equipment to ensure safe patient handling and mobility, and activity orders or mobility interventions to help maintain or improve the patient's mobility level. Mobility assessments are completed once per shift and PRN with changes. This should be documented by the nurse in Epic and placed on the patient's mobility or dry erase board in the room. Patients who may be unable to participate in this assessment are considered Level B for bed rest. This includes patients who have strict bed rest orders for diagnosis such as dural tears, liver lacerations, unstable spines, comfort care measures, uncooperative and combative patients, or have medical instability. These are patients who are ventilated and sedated and have unstable vitals. Once a patient is considered medically stable, you can proceed to testing for Mobility Level 1. Mobility Assessment Level 1 assesses hemodynamic stability, trunk and upper extremity strength, and seated balance. From a semi-reclined position, ask the patient to sit on the side of the bed. If they are limited due to upper extremity weakness or pain, it is acceptable to assist them into a sitting position. Once on the edge of the bed, ask the patient to reach out, crossing their midline to shake your hand or incorporate it into your daily med pass. This will assess their dynamic sitting balance. If the patient cannot sit up from a semi-reclined position or cannot maintain seated balance for 2 minutes, she is Mobility Level 1. Assessment Level 2, or Stretch and Point, assesses a patient's lower extremity strength of the quadriceps and for foot drop. This can be easily incorporated into your routine after listening to a patient's lung sounds or assessing their vitals while sitting edge of bed. While sitting on the side of the bed, ask the patient to stretch one leg and straighten her knee, and then bend the ankle to flex or point the toes. If appropriate, have them repeat with the other leg. If the patient cannot complete this step with either leg, she is Mobility Level 1 and you stop the assessment, but she only has to pass with one leg to continue to Level 3. Assessment Level 3, or Stand, assesses lower extremity strength for standing. Ask the patient to stand from a seated position. You can use an assistive device if indicated. Patient should be able to raise buttocks off the bed for 5 seconds. If the patient is unable to complete this step, they are considered Mobility Level 2. Assessment Level 4, or Step, assesses a patient's standing balance and gait. If the patient is scored as a high fall risk, you should assess the patient while using a safety net. For example, a sling or harness with a ceiling or floor-based lift. This will help reduce the risk of injury to yourself or the patient. You want to ask the patient to march in place at bedside. If this goes well, you then ask the patient to step forward and back with each foot. If the patient completed the task, but with the aid of an assistive device or is considered high fall risk, she is Mobility Level 4 and requires a safety net during all out-of-bed mobility. The patient should display stability while performing these tasks. If the patient cannot complete or shows signs of unsteady gait, she is considered Mobility Level 3. If the patient completes the task safely, independently, with stable vitals, and scored as a low fall risk, she is considered a Mobility Level A, or ambulatory. Once you have determined a patient's mobility level, it is easy to select the best equipment to safely mobilize your patient. Assessment Level 1 is your dependent lift, ceiling, or floor base. Assessment Level 2 is your powered sit-to-stands. Assessment Level 3 is your non-powered sit-to-stands. And Assessment Level 4 is your high fall risk patients that require a safety net.